Welcome to Lovesick, the podcast where we dive into health, wellness, and relationships and their impact on the world today. Come be a part of the discussion and join our community by following us on YouTube, Instagram, and listening wherever you get your favorite podcast. Enjoy the show. Hello, everyone. I'm your host, Dorothea. Welcome back to Lovesick Podcast. Thanks for joining us. And we have a very special guest today. She is an advocate for health and wellness. It's Mimi. Hey, Mimi, where are you?
Hi.
Hi,
Thank you for having me.
Welcome, Mimi. Mimi, maybe you could tell everybody, you have such an amazing background. Maybe you can kind of do it more justice than we could. Maybe tell the world a little about yourself.
Yeah, certainly. So I'm actually from Nevada, and I am a public health advocate, and I've been working in public health and research in the research sector for over 8 years. I hold a master's in public health from Loma Linda University in California, and I'm a certified health education specialist. And then most recently, I graduated with a second master's in healthcare administration from the University of Nevada, Las Vegas, UNLV. And I'm just a strong supporter of minority health and equity initiatives. And I like to help promote and bring awareness of health-related issues and trends that impact our community.
Yeah.
Wow, that's wonderful. Thanks for being here because we want to just get right to it. We know that you would love to talk about colorectal cancer. So we're going to give you the platform to educate everyone about colorectal cancer.
Thank you. Yes, I'll do my best. I'm not a clinical health professional, but yes, I do. I am certified, and I would love to, share this, bring awareness to those in the community.
So when we talk about colorectal health and kind of colorectal cancer, this is a huge, almost epidemic, right? And maybe you can lay the groundwork for people who maybe it's like the most poorly diagnosed, the last to really be registered as far as people being aware. And maybe you can give us some of those numbers and kind of lay the groundwork and the foundation for why people really should be paying attention to this subject.
Yeah. So colorectal cancer, we say CRC for short. It's actually the third most common cancer type, but it's actually the second most common cause of cancer death in the United States. And what's really eye-opening about this is that it's actually hitting the young folks. So those who are 20 to 54 years of age, even though there was a decrease back in 1970, there has now been an uptick starting in 2014. So unfortunately, the incidence rate for both colon and rectal cancers have increased by over 90% for young adults ages 20 to 34 years.
Those are astronomical numbers. I mean, I hope people can kind of take that in and realize what we're talking about is you're talking about literally epidemic proportions of an increase where we saw a decrease for a period of time. Now we're seeing a massive increase. And, to put faces and names, this is one of the things that Chadwick Boseman, this is really kind of what claimed his life. And most people did not realize he was sick. And then also, Pele.
Yeah.
So these are two really dynamic people from very different kind of backgrounds and their experiences experiencing the same type of cancer and with devastating results.
Right. And what they do both have in common is it's actually hitting a lot of the African American men. So there you have it. So that's evidence of how prominent this disease has become. So it's so unfortunate.
Now, for young people what are the first early warning signs? What are some of the signs, especially that people are missing?
Good
That's what I was
question.
about to ask.
Yes.
Well, some signs and symptoms could include persistent change in bowel movements, rectal bleeding or blood in the stool, maybe change in the shape of the stool, if you're feeling weak or fatigued, or there's just an unexpected weight loss, and also prolonged constipation or diarrhea. So if you are experiencing any of those signs or symptoms, please see your healthcare provider right away. And that's why, you know, people in the healthcare field are trying to promote screenings, because screenings can help can help prevent, these things from happening. And you don't get screening when you feel these or when you get these symptoms. Screening should be done, on a frequent basis, and not when you are experiencing signs and symptoms.
Let's
like a
let's
prevent-
talk about, I'm sorry, let's talk about screening. Like what types of screenings are there for, people that may feel like they have the disease, or, is it something preventable?
Yeah, so there are a couple screening tools that are out there. So there's the FIT test that can actually be done in your own home. Actually, there's an at-home kit. I think I saw one recently at my local CVS. So that can detect blood that's in the stool, but it could miss polyps or cancers. But if you do see that there is an abnormal test, then you would proceed with a colonoscopy. Usually colonoscopies are done for those who are aged 50 and older, but because of these high trends, they've actually reduced it to about 45 years for colonoscopy now. But so the FIT test, which is called the fecal immunochemical test, that could be done at home. There's the colonoscopy. So that in that case, they take a biopsy, they can remove pulps, but that's more invasive, right? And requires sedation. And that one is done every 10 years. But again, it's usually those who are 50 and above, but now they brought it down to 45 and above. And then another type of screening that can be done is the CT colonography. And for that one can be done every 5 years. And but it also does not remove any type of pulps like the colonoscopy does. But it's a new test, and it can actually take 2 to 3D cross-sectional view of your colon, which is actually 5 to 6 feet long. So these screenings are very beneficial. Again, it's best to get them done regularly and start, since we've seen that rates have started to include those at a younger age, just talk to your healthcare provider and see if you can start getting, screened as soon as possible. And not only when you are getting, these symptoms.
Yeah, I would say, like, because we're seeing it people in their 20s, the FIT test is pretty non-invasive. It's a lot like if you've ever had a dog. I mean, like, I hate to use this example, but you're basically taking a stool sample and passing it on, right? So it's non-invasive, right? So I think while that's kind of a gross way of looking at it, it is a simple way of looking at it. It's like it's not a big invasive process, right? And so
Right.
especially for 20-year-olds, especially if you've had any kind of like bowel issues or extended
Right.
constipation or have a tendency to have loose stool. I'm trying to pick the right words to phrase that. It's a good
Yeah.
idea to start looking at these things, because what we're seeing is, whether it be food or environmental or whatever the combination of things it is kind of hitting people right now, it's hitting people much younger.
Right.
And that's a good place to start. A lot of people are very uncomfortable with the idea of getting a colonoscopy early. But that might save your life. I think that's the other part, is I think we need to destigmatize some of these treatments and some of these scannings and like start talking to your healthcare professional, start reaching out as an advocate. Is that what you would suggest for people to start with?
Yes, definitely. Yes. start with your healthcare provider, especially if you have any type of risk factors. So so when we're speaking of risk factors, some you can control and some you can't control. So in terms of this disease, some factors that you can control is your diet. About 35% of cancer deaths are due to your diet. Exercise, reducing your consumption of red meats, processed meats, animal fats, refined carbohydrates, and start consuming more fish and other beneficial fats, and increase your exercise. So those types of things are beneficial factors that can help reduce your risk.
So, Mimi, I have a question. How accessible are these screenings? Because if I'm 20 something, that's not even going to be on my brain right now. Is it like, and is also like insurance, or is the state of like Nevada offering any type of programs where people can have access to screenings?
Right, good question. So because this disease is impacting more of the younger generation, hospitals are beginning to also promote it at the hospital level. And they're also trying to provide the community with, free test home kits. But again, I saw one at my local CVS. So you can pick one, you can pick up a fit test at, your local CVS store, and you can start from there. And again, if there are any, it's a test, so it'll let you know if it has catched anything abnormal, and you can start from there. It's not very expensive. It's less than $50. I think it's even less than 30. Can't quite remember the exact amount, but you can start there. And then, yes, usually with colonoscopy tests, it does go through insurance because it's a hefty and expensive exam, but you can always go through you should just start with your healthcare provider, and they can help direct you from there.
And I have a question. As an advocate for this, how are you spreading the word to people to make sure they get tested? Because, a lot of people always assume, well, if it doesn't run in my family, is it really going to happen to me because it's not hereditary or anything? But like, how, as an advocate or as an ally or someone, like, how can we start, encouraging people to get screenings and just to focus on their health?
Well, first, thank you for giving me, a platform to share this,
Absolutely.
to talk about this. And we need to be our own advocate, and we need to also be an advocate for others. So, starting with, being an advocate for your own self, and, seeing how you can, get screened yourself, and informing your family members and your loved ones and your friends of this disease. Is beneficial. And I try to contribute to, newsletters such as DEI newsletters. And so in whatever opportunity opens up, I like to share and inform and bring awareness of this disease. So, and some of the risk factors, if I might add, are, if you're African American, if you are male, if you are older in age, if you have type 2 diabetes, if you have a family history of cancer or any other type of GI issues, you're at higher risk than others. So that's when you would want to look into the FIT test or see your healthcare provider.
And I would tell young men, there's this thing about young men who don't really like to go to the doctor, and we're really terrible about it. But in the African American community, because of the risk factor going up, because of the number of really outwardly healthy young men, I think this is a really important thing that you start kind of taking awareness of, because we do not want to lose part of that generation.
Right.
These young, powerful young men should be living out their lives, and if we can catch it early, there's a very good chance you could. And I'm curious for you, Mimi, like, what drew you to this as an advocate? Like, what brought you to this? Is there a personal connection for you, or what is it?
Well, mhm. Yeah. So while I was a student at UNLV getting my master's in healthcare administration, I I was working on a project at Mountain View Hospital, and I was looking at a whole bunch of data, and I came across this the data set that was presented to me on CRC, and it just amazed me how it was really hitting African Americans and males, and it was at a higher risk, and the percentage of screenings was really low. It was less than 25%. And this can be a preventative disease if you catch it early. So that's why early diagnosis and screenings are so very important, because if you catch it early, you have a higher risk of living a longer quality of life. So so it was just the numbers were just mind-boggling, and I was like, no, I want to help promote the importance of screenings when it comes to CRC.
Yeah, it's devastating that a disease that's largely preventable is claiming so many lives. And Chadwick was such a vibrant, powerful person.
Yes.
Yes,
Such an
the superhero
inspiring,
indeed.
Yes.
And so, I mean, that one hits me personal. To look at a young, strong, outwardly to the world, like he had achieved so much in a young period of time. But what is also shocking to me is here you have a giant example of the importance of the awareness, and that part of his story is kind of lost. Like, I would think he would be a marker for other people of like, it's time to take some awareness. It's time for us to take awareness in our community and like make sure that we don't lose amazing people.
I totally agree. Yes, and that's why I've joined this effort to do that. Yeah.
Well, we commend you for doing so. Also, Mimi, what are the prognosis for anyone who find out later that they have, colorectal cancer and say they're in stage 4 because they never had, they had symptoms and maybe never followed up on the symptoms. And then by the time they got to the doctors, they were at the last stage. So in your opinion or in your research,
or doesn't know the signs,
right, or doesn't know the signs. So in your opinion or research, can you say what the prognosis would be for someone that's finding out at a later stage?
Well, only a clinical
Right.
a healthcare provider would be able to, but I mean, it is so unfortunate that that person found it at such a late stage. And it could be that some of the signs were asymptomatic and they didn't, they weren't able to experience any of those signs and symptoms that I mentioned previously. But it's good that they found it and that they should seek treatment and follow whatever advice their healthcare provider has, the plan that they have developed for them. But I would just say always stay positive, continue to reduce your intake of red meats and processed meats, because studies have shown that diet contributes highly to getting colon or rectal cancer. So
Yeah, and I think it's really important. We talk about diet a lot, but I don't think people really get the specifics of that. I mean, we talk about red meat and processed meat. You got to take in more healthy fibers, more fruits, more vegetables. Like, be specific about it, but also how you take them in, because we kind of start working against ourselves. Because like people are like, oh, I'm going to eat it, but I'm going to eat fried zucchini.
Right.
Like, I hate zucchini, but fried zucchini, like that's a step in a direction.
On
but it's
top
not-
of my red meat, but I
Right.
have the
Right.
veggies right there.
Right.
Yeah.
And
So I'm eating healthy.
Yeah.
So, it counted. There was something green on
Right.
the plate, right? But like, we do have to start making this conscious effort in our homes. And I think it starts even before, because you're saying people are being diagnosed as early as 20. That means part of this is a parental thing. I mean, as all of us being parents here on this side as hosts, it's not easy always to get your kids to eat
For sure.
those
Right.
fruits and vegetables, but you got to
That's
also
true.
take, because this is a cumulative thing too, isn't it, Mimi? Like, this is a cumulative risk factors start piling up over time, and polyps start to grow, and these things. And usually people are asymptomatic, meaning they don't have initial symptoms. They don't know right away.
Right.
And
And
are
that's
you?
what's. Mhm.
Go ahead. No, please. No answer.
Oh, I just wanted to add, and that's why, researchers still don't know, like, the number one issue that is causing young people to contract this disease, which is, I think that we as a community, we need to, be better informed about this disease
I
and make
agree.
sure that we are putting in efforts to towards more research to figure out what the real issue or the number one factor is, because still scientists don't know.
That's terrifying.
That is very terrifying.
And this is one of the things. There are food factors. Our food in around the world, but in our country in particular, there's a lot of stuff that just doesn't make sense when you read labels. I'm not trying to sway everybody at home.
Right.
Like, if you really start looking at some of the stuff, you're like, why does that have dye in it?
Right.
Why does that have like some stuff you don't think has preservatives? You're like, that has preservatives in it?
Right.
But that's even when you go to restaurants too and stuff. It's like you can still ask for that salad with that salmon, but it's like the stuff that they put on there sometimes for flavor. And believe me, I've been very into food stuff lately, but it's like, because also that's why they recommend a lot to like fix your food at home, because a lot of people put in dyes and
Right.
and all that stuff. So even if you think you are eating
Healthy.
somewhat healthy, and it's no disrespect to, some of these places that we go to, but it's like, to be flavorful in their way, you're putting stuff in there that you don't know. You're not going to sit there and say, what's in my salmon? Do you have salt, and how much like XYZ things you're going to put in there, right?
What kind of salmon?
Oh,
Right.
Is it
That's true,
farm
too.
raised?
Is it wild?
Exactly.
wild?
Mm-hmm.
Is there color added?
Yep.
Right.
Or is it naturally this color? How is it preserved?
Yep.
How is it held? How long has it been here? Like,
How long has it
these
been?
these are all questions that we don't really know, and I'm not blaming any of those things. I want to be clear to the audience. What I would say though is, it means you don't know fully what you're taking in.
Right.
And that's when we don't know the factors of this. And the other part is, as families, as community,
Right.
not being aware. Like Mimi, were you shocked when you got into this program and you started looking at the numbers? Like, was this one of those things where it just hit you and you're like, how could we not be talking about this?
Yes. Yes, it hit me so hard that I just had to, say that, oh, can I see more numbers? How can I be more involved in this? And because I still don't understand why that till this day, they still don't know what we know the risk factors, and we know that it's about diet and exercise, but we still don't know why it's hitting the younger generation at a faster
That's so
rate.
scary to me.
Yeah.
Are there any,
frightening.
Mimi, are there any support groups or any special events for this disease to continue to help bring awareness?
Yeah, I mean, it's this disease is, it's global, it's national.
Yes.
So different, I know that different communities are doing what they can to bring, awareness. The American Cancer Association is a huge leader in, promoting and bringing awareness as well. And they, communities and health agencies can start there. But I've noticed that there has been an increase in bringing awareness of this to the community.
What are the areas of the community? And I don't know if you have these numbers, so if you don't, it's okay. But what are the areas of the community that you feel like we're missing this portion of the connection? Like, we're missing the kind of revelation for them.
Yeah.
That's a good question.
I would say the young men, the young African men, I think. I mean, I feel like we need to bring this to the barber shop because
Bro, you
You know,
told me
it's
about that.
No, I love that.
No,
an
I think that's
event.
great.
Remember you talked to me about that of
Well,
how
Yeah,
and
We'll have her.
recently.
Yeah,
and
tell
some
us.
of these communities, right? Like,
Yeah.
Can you
Right.
talk to us about that briefly? Because you did share with me a little bit about how you guys or somebody went into the barbershops and talked about this disease, and it was a hit, basically, you said.
Right, mental health. Yes.
Yes.
So, so the Office of Minority Health partnered with a few close partnerships, and they brought mental health to the barber shop in
That's a good idea.
I think it's a great
North
idea.
Las Vegas, and there were about
Mhm.
40 men in attendance, and
And that's a
it
lot
was
for men, 40 men in
it is.
attendance.
It is because we're notoriously
Wow.
bad for getting together. And we're notoriously bad at sharing information.
Wow.
I think the barbershop might be kind of the secret place to go. And the reason I would
Yes.
say that is because if you get men talking about it in a space where they feel safe and comfortable,
Mhm.
then you
Right.
might. And here's the thing: if you're having a bowel issue, nobody wants to own that. Like
Yeah.
that's like the last thing you want
Yeah.
to tell anybody, right? Like even talking about it in this is kind of like, I don't want to sit there and tell somebody how everything's working, right? Like that's not an
Right.
area that most people are comfortable. So, although little kids love to tell you.
Oh,
So
little kids.
So I guess maybe
Maybe
should
we
be
need to
talking
think
them
like them.
younger, yeah, right?
Right.
Because maybe if we were telling jokes about that it's not working or it's working too well, like maybe people would take notice, right? But it is a weird
True.
thing because it's not a topic that anybody really wants to talk about. But
Right.
in a barber shop, that's where we
I
have
like
to we
that.
have to go kind of. I think this is one of the goals of this show, but
Yes.
like that we're trying to share with people is if we can get more grassroots about health,
Mhm.
if we can start having these conversations and to open people up, because I don't know that CRC is something that young people are thinking about. And
They're
they
not.
very much should be from the numbers that you're saying, right, Mimi?
Yes, definitely.
Yeah, they're not thinking about that. I mean, the other thing is too, Mimi, I'm sorry. What other suggestions do you have that can help, like, really the world on what they can do about being an advocate for colorectal cancer?
I would say, well, first of all, I do think that healthcare professionals should, consistently review the literature that is out there so that they can better advise, their patients on, what new screenings are available. Are there any new risk factors and things of that nature? But we ourselves too need to be an advocate ourselves and take better control and be more cognizant of what we're eating and how we are keeping our bodies active and just being aware of our bodies and just taking the precautions and seeing your healthcare provider at least yearly and getting checkups. I think that we can start there.
And I'm gonna say for young men are notoriously bad at getting
course.
their annual checkup because they
Absolutely.
feel good. You feel
Yeah.
strong. You feel
Yeah. Nothing's
vibrant.
wrong with me. I don't feel anything.
Well,
Yeah.
Right.
and
But again, it
Right.
could be
It's not even
asymptomatic though.
right. And that's the thing is it could be asymptomatic.
Sure.
The other
Right.
part is sometimes partially for wishful thinking, but when we go back to like these are symptoms that you don't really want to share with the world is, oh, I just had food poisoning. Or oh, I just ate too much of this. Oh, oh, maybe I drank too much, right?
Making excuses.
Yeah, and we keep kind of pushing it off, going, "Oh, well, that's weird," or "I was uncomfortable for a day," right? Well, that's how symptoms start, right?
Exactly.
Like
Yep.
that might be stage 1,
Yep. The
Mhm.
early
and
signs.
you're having the occasional flare up, right, or the occasional symptom,
Absolutely.
and then you wait and you wait and you wait, and before you know it, now you're at stage 3 or stage 4, and the potential for dealing with it is totally different. What you're facing is totally different.
Right. You want to catch it early. So you want to make sure you catch it, at stage 1, stage 2. So it's the earlier you get in to see your healthcare provider to see, what's going on, the better the outcome will be.
Now, Mimi, you're also an advocate for mental health, right?
Yes.
And I think all of these health things are interrelated. You and I, as a group, we talk about this all the time. And Mimi, I think it's, what are some of the mental health things too that you really wish people would be aware of? Because while we're talking about health, being sick is a huge mental health impactor, and dealing with diseases, and even the fear.
Yep.
As we talk about this, I'm sure there are people hearing this thinking to
True.
themselves, oh man, just another thing I need to get screened for, one more thing that I have to be worried about. And there's a mental health toll to that. I think that's also why sometimes people run away from doing it. They're like, I'm going to pretend I'm okay. What are the mental
Or they
health
don't want to
portions?
know.
Yeah.
Right.
Sometimes people don't want to know.
The fear of not knowing. That's one of the main, I think, issues. You want to know, but you don't want to know.
Right.
But, you have to know, because then how are you getting treatment if you don't know what's wrong with you? But I understand how some people are afraid to go to the doctors because they don't want to hear that potential bad news.
Right.
Or to go away.
Or to go away.
Young,
Right.
Yep.
young guys in particular, I'm going to say that one gets us in trouble more often than not. Is
Are you talking about yourself, Michael?
For the most part, I've been pretty healthy, but I think, listen, spending a lot of time around young men, it's the truth. Is they're like, no, that's not that big a deal. It'll go away, right? Like, it'll go away until it doesn't.
Until it doesn't.
Right.
And then you're like, oh, wait, something might be wrong. Let me go get
Right.
it checked out. And
Right.
it's like,
or something
to
is
prevent it. Yeah.
right.
Yep.
All of a sudden, it's I can't ignore that anymore.
Yep.
Like, listen, Chadwick Boseman, people mocked him for a year about his weight loss.
Yep.
People mocked his kind of disappearing for
Which
periods
was
of
sad.
time. People thought he was being lazy. People made fun of him at events where
Yep.
he looked tired, because the world didn't know he was undergoing chemo.
Mm-hmm.
Right.
But we might have been able to prevent that if we had caught it earlier. And again, that's an example of like, I never want someone to die or someone to suffer one of these things. But one of the things about it is, I always think to myself, at least we should learn something from this, right? This,
Right.
like his memory
Mhm.
should be a difference maker. It should be almost a line in the sand where you say to the world is like, CRC is here.
Mm-hmm.
You need to take notice of this. He should be in a reminder for people of like, it's time to take notice of this because we don't want to lose any more great people. And that's should be
Right.
the positive side of
I
losing
agree.
a great person.
Yep.
Right. I agree.
Well, I know that you probably have so much to do for the advocacy. Yes. Are there any tips or anything that you would like to leave the audience with before we wrap it up, Mimi?
Yeah, I mean, I just like to say that prevention is better than treatment, right? So if you can take that extra step to visit your healthcare provider, to get screened, especially if you are within the high risk factor range, you should do it. And it's these stories, with Chad or Pele. These stories should, drive us to make better choices and to go get screened and to take better care of our health and our mind. And yeah, I mean,
I want you
And
to
I
say
would
that.
also
I
like
want
to
you to
say
say that
that-
one more time loud for the people in the back. Prevention
Prevention.
is better than
Prevention,
treatment, right?
prevention,
That's what you
prevention.
said, because that was brilliant. Mimi.
Yes.
Like I know you have a couple more, but one more time loud for the people in the back. Say it again.
oh, prevention is better than treatment.
Yeah.
That's right. Well,
Oh, that's
on
so
that
powerful.
note, I would like to thank you. We would like to thank you for joining us and definitely sharing your expertise to the audience in reference to colorectal cancer. And I do see that heart back there. That it's nice to see that you probably use that with meditation and just kind of like stringing it. But it's really amazing to see the harp back there that you play, regardless if it's just a little bit or not. But thank you again for joining us on Lovesick Podcast. Please share with everyone about our podcast and help us to get the word out regarding the type of shows that we actually try to put on topics and elaborate on. So thank you so much, Mimi, for your time. We really appreciate it.
Thank you so
all
much for joining us. Appreciate you.
Thank you.
All
Thanks for
right.
your time and helping me to share this this hopefully preventative disease. So
Absolutely.
We appreciate it. Thank you so much. And you have a great evening. Thank you again, Mimi.
thank you. Take care.
Okay, bye.
Yeah, for the
Bye.
audience, as we wrap this up, like, what a beautiful, beautiful soul who literally became an advocate
I know.
because she saw data that she just didn't like, right?
Yeah.
Like, and to become this advocate who's literally changing people's lives,
Mhm.
that's what we need. And hopefully, we'll put up her information, along with this podcast so
And
that
some
people can kind of
resources.
find
Right.
her and some resources.
Exactly.
For people, this is the beginning. If you didn't know about CRC, like I didn't realize some of the numbers, and I didn't realize people were as low as 20. The dramatic
Oh,
increase.
that's scary to me. You
It's scary,
know,
yeah.
It's scary.
Because also, like, think about it. Remember, she said, like, people, they would tell you to get these colonoscopies at like
Right.
50
50.
something. And you're
Yeah.
like, by the time you get there, it's way too late
Way
for some.
too
So
late,
they are
especially 20.
advocating for it earlier.
Yeah.
But I do also like the fact that they do have screens,
The fit test.
the fit tests
Right.
Yeah.
that you can get, like she said, at a CVS.
But insurances need to pay for that because some 20-year-olds, they don't have insurance.
No.
And so they're not going to go and spend $50 on a fit test.
Well, which is also probably why they don't go to the doctors
There
often
you
to get
go.
screenings, because
Yep.
it's like, unless something's wrong with me, I'm not going to go spend money.
That's it.
But I'd love to see, if you're a parent and you have a kid, like I'm sitting here thinking of my kids in their 20s, thinking to myself, you guys should all take a fit test. And I'd never thought about that prior to Mimi. Is like, you probably should be taking one of these tests. If nothing else, that's not a definitive, but at least it's some peace of mind. At least it's some idea.
It is.
And
Yeah.
for anybody who loves young people, or if you're in your 40s or your 50s and you haven't gotten,
Yeah.
the colonoscopy yet, right?
I mean,
You
now I
need
kind
to-
of want to go do it.
Well, yeah.
Yeah.
Well, it's the thing.
I mean, no joke.
If you're really listening, right, it makes you
Yeah.
start thinking to yourself like, hey, man, it's time, right? Because I'm going to say it again because she said, right, prevention
Yes.
is better than treatment.
Absolutely.
And that's the
Absolutely.
nature of it.
And, we want men to actually pay attention to what Mimi said because it seems to affect men more than it affects women.
So we need to encourage.
So we need to encourage men to really pay attention for the prevention.
Yes.
I agree.
And yeah,
I agree.
definitely.
100%.
That's what I'm talking about.
So thank you, everybody.
Thank you.
Appreciate you
Thanks for-
coming in and
yes.
kind of diving into this topic with us. And
Yes.
if you want to learn more, you can through our social medias, and we'll catch you on the next Lovesick podcast.
Right. Thanks for joining.